Welcome to Adapt NCLEX Fluid Electrolyte IV Therapy. Do you want to master this content? This is part 4, and this is the end of that fluid electrolyte IV therapy. This one, you want to watch it. I'm going to challenge you. I'm going to make you more confident in answering these questions. NCLEX practice question, we're going to use critical thinking, test-taking strategy to answer this question. Stick around with our pharmacology practice test 19. Patient is receiving what? TPN as the solution stop abruptly due to what? Pump failure, which action is appropriate. That means priority. You know, the content associated with TPN is very important. We see it all the time. When the patient is receiving TPN, what is the problem? They're more at risk of what? Hyperglycemia. This is a problem. But when you stop the TPN, what is going to happen to the patient? Hypoglycemia. And therefore, abrupt discontinuation of TPN, the first thing you need to do is to prevent hypoglycemia. Which of these fluid will provide glucose to the patient? D10, call the provider, flush with normal saline, give a bolus. I know you know. Put down your answer. Stop the video. Put down the concept. And you got it. We need to give the patient what? D10, so that will prevent hypoglycemia. This is the straightforward way to explain it to you. And I know you got it. First question is done. Number 2, which IV fluid order should the next question for a client with SIADH? I'm trying to wrap up all the 3 series we've done, and this is the 4th one. So by now, you should be able to pick the buzzword and then follow me. SIADH, right? SIADH. What is the problem? You have a situation where you have what? Dilutional hyponatremia. And therefore, we should correct the hyponatremia. Which order should you what? Question. Anything that will continue to further hyponatremia is the wrong answer. Number 1, fluid restriction is good. It will stop you from drinking water so that your sodium go up. D5W, what do you think? 3% saline is going to increase your sodium. I need my sodium to go up. The 25 ml is good. You shouldn't run it too fast, so don't get confused. It's because you got to run it slowly. Furosemide will get rid of the free water. And therefore, what do you think? D5W, if I give it to you, I'm going to dilute more of your sodium. The other actual question is number 2. And that is the concept. Avoid hypotonic situation in this case. Which action should the nurse take first? Underline the buzzword for this question. When you see a long question like that, underline it. And nurse is caring for a client with what? Central venous catheter. Fine. Who suddenly develops shortness of breath. Okay. And it has chest pain. Wow. And tachycardia. What is the problem? What is going on? What action should the nurse take first? Ask yourself. Breathing issue, chest pain, tachycardia, connected. And I'm getting fluid. What do you think is going on? But all of a sudden, patient has shortness of breath, chest pain, and tachycardia while they have what? Central venous catheter. The fact that it happened acutely is your diagnosis. Connect the buzzword. Do you call the doctor? Do you clamp the tube? Do you place the patient in the Trendelenburg position on the left side, or do you give them oxygen? I want you to know this. This is what? Connect the dot. Once again, connect it. Shortness of breath, chest pain, and tachycardia. There's a bunch of things happening with the catheter. This is what we call air embolism. You have air embolism. How do you manage air embolism? I call it clap for air. What is the clap? The clap is the C-L-A-P, and that's how the order that you should take action. And they said, what is the first thing? You should clap. You should do the C. So the C is what? Clamp the catheter. L, place them on the Trendelenburg in the left side. A, provide some oxygen. And P, call the doctor. This is how you take care of a patient with air embolism. And that is what we call clap for air. And what does that mean? Clamp the catheter. The L lie down on the left side to Andelabel with your head down. A, give them oxygen. P, call the provider and prepare to give them fluid. You have to be able to pick the buzzword and know the diagnosis. Number 2 is your right answer. The provider prescribed IV phosphate for what? Severe hypophosphatemia. That means low phosphorus. Which action should the neck take first? Patient is what? I'm giving you IV phosphorus and you have low phosphorus. What action would I take first? Do I give it through IV push? Do I assess your renal function? Do I hold the phosphate oral form? Or do I start through IV calcium line? There's a content here, and look at it. I always say, whenever you're giving electrolyte to a patient, always look for their kidney function. And that's the key. Never give phosphorus to a patient without checking their creatinine, because this will be cleared by the kidney. If the kidney is not working, phosphorus goes up. And you should not combine phosphorus and calcium because they hate each other. Therefore, number 2 is the right answer. And then she's teaching a client with what? A bunch of phosphorus, hyperphosphatemia. Which food to avoid? What do you think? Which food contain high phosphorus? This is a content base. It's whether you know it or not. Milk is bad problem. Chicken is bad problem. Nuts, bad problem. Soda drinks, bunch of phosphorus. White rice doesn't have a lot of phosphorus. A client is post-op NPO receiving what? IV fluid. The provider wants to provide what? Maintenance with some calorie. There's a buzzword there. Underline the buzzword. What is the buzzword? I want you to take a look at it. Maintenance fluid and calorie. That means I have to give you isotonic fluid and glucose. That's all. I broke down the question for you. You see the 2 lines, I make it 2 weights. That's the way I want you to do it. Every time you see a question, break it down into weights. 2 weights, isotonic and glucose. Which one is isotonic and glucose? You are not isotonic. You are not isotonic. You are isotonic. You are isotonic. But which one is glucose? D5. Number 1 is your right answer. That's how you could approach the question. A newly graduated nurse is caring for a client with what? 50% total body surface area, which IV fluid indicate the nurse correctly understand fluid resuscitation in major burn. All I'm saying is, what fluid do you give? You're going to give a patient who burn himself. 50%, whatever, this is all can be written into words. Burn fluid. That's all. Burn fluid. Which fluid do you use in the burn patient? Lactate ringer, normal saline, D5W, and that. The key is resuscitation. So you need resuscitative fluid because they burn themselves. They need a bunch of fluid. So you give them isotonic fluid. Which one is isotonic? Number 1 and number 2. But which isotonic is the best? Because you're going to give them a large amount of fluid and you need a bunch of electrolyte. Which one has a lot of electrolyte? Lactate ringer. The second thing is too much normal saline will cause acidosis. This patient already have acidosis. And because of the large amount of fluid needed, we avoid normal saline. So they're going to get lactate ringer. And that is the content associated with this. So that's what you need to know. Lactate ringer is a balanced fluid. A client with chronic kidney disease, that's a buzzword, with the phosphate of that 6.2. Your kidney is destroyed and your phosphorus goes up. Which additional finding does the nurse anticipate? These are straightforward to let you know, put all the 3 videos together and to come back and answer these questions, right? Kidney, your phosphorus is high. That means anything that can affect your kidney, what is associated with that? That's all. Your calcium is going to go down. Your sodium can go anywhere they want. You're going to have metabolic acidosis. The potassium goes up. At the same time, go back and use strategy. Whenever your phosphorus is high, the best answer is calcium. Calcium go low. And so as you increases your phosphorus due to your kidney injury, your calcium is going to go down. Number 9, NCLEX for what? A client, what is the issue? Calcium is 70, and the phosphorus is 5.5. This is the lab work they review. I'm trying to put it together so you can see. Calcium is low, phosphorus is high. Which condition should the nurse expect or know that? What is the problem? That means this patient kidney is in trouble. And when a kidney is in trouble, your PTH, which is responsible for your calcium, is low. Parathyroid hormone, right, is responsible for that. And therefore, if your calcium is low and phosphorus is what? High, is because you don't have parathyroid hormone. Number 3 is your right answer. This is unrelated to 1 and 3 and 4. They are not related to calcium metabolism. Even though you have vitamin D deficiency, look at it. Vitamin D deficiency will lead to what? Low calcium, but it does not affect your phosphorus. That is the key aspect of that. Therefore, number 3 is the most consistent finding you will know. A client with CVC, that means what? Central venous catheter, sadly developed what? Ventricular ectopy. It's a big word. Don't worry. By explaining to you, you may see this in NCLEX. The nurse suspect catheter irritation. Forget about the ventricular ectopy. It's designed to distract you. I have catheter going to my heart and it's irritating the ventricle. I think it's a catheter tip. What action would you do? Do you clamp the catheter? Do you give them oxygen? Do you withdraw the catheter? Or do you continuous cardiac monitoring? Put down an answer. Let me know what you think about this. I have the catheter irritating my ventricle, and I think I need to do something. Do I put the patient on a cardiac monitoring? Do I withdraw it back? Do I give them oxygen? Or do I clamp it? We already seen this content in the previous video. You should watch it. You clamp the catheter when you think it's dislodged. There's no evidence of dislodgement. It said irritation. Oxygen does not address irritation. Withdrawal may address irritation because I pull it out a little bit from where it's irritating. Cardiac monitoring does not address the irritation. Therefore, what is the right answer? Number 3. This is how you answer question. If arrhythmia are caused by mechanical irritation, please pull it back, reposition the catheter. That's all. Number 3. The next is reviewing IV fluid prescription. Which of the following fluid matches with the appropriate tonicity? That means which fluid is associated with the correct label. 0.9% is the hypotonic, or 4.5% is the hypertonic, D5W is the hypotonic in the body, and 3% normal saline is the isotonic. As you can see, 3% is greater than 1%. Therefore, it cannot be isotonic. 0.9% is associated with isotonic. It cannot be hypotonic. 0.45% is less than 1%. It can never be hypertonic. What you're left with is number 3. Even if you don't know it, you got to pick it because a D5W is isotonic when it's in the bag and hypotonic when it's inside your body. That's your right answer. A client with newly inserted what? Central venous catheter show frequent PVC. This is the same question, but you can see this in the NCLEX. They will give you variation of the question to test your content. I have a central venous catheter, shows what? Frequent PVC. That means something is happening to the heart. The catheter is irritating the heart. That's all. I've given you the answer. Vital signs are stable. What do? Document the arrhythmia and continue monitoring. Let the doctor know and prepare to give the patient prescription. Check the catheter length and then use cord compression. Think about it. The catheter is causing PVC. I never use the word irritation, but the buzzword is because it's causing, I'm seeing frequent PVC. I know that the catheter is irritating the heart, which is the same thing as what we saw, ventricular ectopy. What do? Pull the catheter back. I never use the word pull it in the answer choice, but I want you to try to learn certain variation of answers. This is not a arrhythmia that you need to monitor. There's something irritating the heart. One is wrong. Notify the provider and prepare. Of course, I'll let him know, but that's not is my priority. The catheter will continue to irritate it. It does not need prescription to fix this problem. I need to pull back by checking the insertion site and see if the length is too deep inside or down. Therefore, 3 is the best answer choice. Mechanical irritation of the atrium by the deep central venous catheter tip is a common cause of PVC. Adjusting the catheter is the priority, number 3. And this is assessing a client with calcium of 12. We saw it on the previous video of causes of hypocalcemia. Now, what are the signs and symptoms of hypercalcemia? We saw signs and symptoms of hypo. Now we're seeing hyper. 12 of calcium is hyper. What do you see? And I give you the content. I said when your calcium is high, your symptoms go down. So look here and pick things that is going down. Constipation look like it's going down. Kidney stone look like it's going down. Your muscle is weak, going down. QT, shorting. Shorting means it's short, going down. Mr. C, what is that? It's going up. Depression is going down. And therefore, what is your buzzword? What is your answers? You can see this. You already seen the C, I call them the C and the T signs. They are bad. They are the common signs you see associated with what? Hypocalcemia. And therefore, it's not related. That is the only answer. But all of them are associated with what? Hypercalcemia. You groan, you form stones, you burn, and you mourn, and you have psychotic overtone. And that's number 1, number 2, number 3, 4, and then number 6. 14, a healthcare provider prescribed IV fluid to improve a client oncotic pressure, oncotic pressure. Which prescription should the nurse anticipate? The buzzword is oncotic pressure. That means we're going to increase the pressure of our what? Fluid, our blood. What is going to do that? Anything that has protein will do that. That's all. Oncotic is related to protein. I've given you the answer. Like I said, turn the question into words. I've turned this question into words by making it protein. 25% albumin as protein. Fresh frozen plasma, protein. Blood as protein. Normal saline has no protein. Lactate ringer has no protein. Therefore, 1, 2, 3 are your right answer. Any solution that contains protein is your right answer. Thank you for watching. NCLEX practice question. Fluid, electrolyte, IV therapy, 4 videos for our pharmacology series. You're all ready to ace your NCLEX, beat IV fluid, electrolyte, and IV therapy in nursing school. Take care of yourself, and thank you for watching. Good luck.